Hi everyone, my name is Beatriz Venzor and I will be talking to you about intracranial aneurysm calcification. This presentation is for RADR 2233 Advanced Medical Imaging class, spring of 2024. I will be describing what a calcified intracranial aneurysm is, discussing what causes an aneurysm, the role of imaging for diagnosing an aneurysm, what the primary modality is for this pathology, and the additional modality that goes with it. I will be demonstrating the pathology and explaining the image appearance, how can an aneurysm be treated, and the care and prognosis for a brain aneurysm. What is an intracranial aneurysm calcification? Intracranial means within the cranium, inside the brain, and an aneurysm is an abnormal enlargement of a blood vessel. Calcification is accumulation of calcium, and in this case, calcium is building up inside the artery. There are two types of aneurysms: a saccular aneurysm, also known as a berry aneurysm in image A, and a fusiform aneurysm in image B. Image A has an outpouching appearance, and image B looks like a dilated blood vessel. Causes of an aneurysm. Some causes are diseases, blood infection, a head injury, or birth defects may cause an aneurysm. A blood clot may also cause an aneurysm to form. Since the blood is constantly pushing through, the blood may make itself around the blood clot and cause the blood vessel to dilate. This type of aneurysm is called a fusiform aneurysm. Aneurysms are formed when there is a weak spot in the artery. These weak spots usually form where the artery branches. Over time, the pressure of the blood flowing through the artery stresses the weak spot and causes the weak spot to bulge out and form an aneurysm. This aneurysm is called a saccular aneurysm and is the most common type. Over time, the aneurysm may grow and push on nearby brain tissues or nerves. Blood may also leak from the aneurysm or rupture, causing hemorrhage or even a stroke. Aneurysms can happen over time on their own or even be provoked by an interventional procedure. Gaining access through an artery may weaken the artery wall and cause an aneurysm to form days after the procedure. Some clinical risk factors that could increase the chance of developing an aneurysm are old age, having hypertension or high blood pressure, being a cigarette smoker, consume heavy alcohol, and use drugs. The role of imaging. Imaging technology plays a crucial role in the diagnostic process. CT and MRI imaging can be used to detect an intracranial aneurysm. CT is the primary modality since it's rapid, inexpensive, and widely available. It is commonly used as the first-line imaging modality for evaluating strokes. Aneurysms may have stroke-like symptoms. An MRI is usually a follow-up scan after a CT. MRI is used if additional imaging is needed to evaluate an aneurysm in greater detail. These images here are the CT images I got from my site. I have circled each image in red to identify the aneurysm, and I've added arrows to demonstrate the calcification. The image on the left is an axial view of the head. There is a tiny white spot near the posterior side of the aneurysm. Bright white indicates calcification is present. The middle image is the coronal view, and you can see more of the calcification is more inferior. The image on the right is a sagittal view, and it also demonstrates the calcification more inferior and posterior. These MRI images I got online. I circled the aneurysm in red and added arrows to identify the calcification. Image A is an axial view and image B is a coronal view. Both images were scanned using T1 imaging. Image C is also an axial view, just like image A, but was scanned using T2 imaging. This patient had 2 large calcified aneurysms in the frontal lobe. The goal of brain aneurysm treatment is to stop or reduce the flow of blood into the aneurysm. There are 3 types of treatments. In endovascular stenting, your surgeon inserts a catheter into a blood vessel in your groin or wrist and threads it to your brain using fluoroscopy. The provider places a mesh tube in the spot of the blood vessel that contains the aneurysm. The mesh diverts your blood flow away from the aneurysm. This method may also be called flow diverter stenting. For endovascular coiling, your surgeon will insert a catheter into your femoral artery using fluoroscopy and advance the catheter through your arteries until it reaches the aneurysm. The surgeon will insert 1 or more flexible wires through the catheter and into the aneurysm. The wires will coil up and cause a blood clot to form inside the aneurysm, which will block off the aneurysm. And in surgical clipping, your surgeon will make an opening in your skull near the aneurysm and place a small metal clip onto the stem that connects the aneurysm to your artery. The clip blocks off flow into the aneurysm. Small unruptured aneurysms may remain untreated but will require monitoring to make sure it's not growing. Some factors that determine if an aneurysm is likely to rupture is the size of an aneurysm. If it is greater than 24 millimeters, the risk is high. If the aneurysm keeps growing over time, the location of the aneurysm matters because posterior aneurysms have a higher risk of rupturing than anterior aneurysms, and people who are older than 70 years old are at higher risk of an aneurysm rupture. Care and prognosis. Regular health checkups and imaging tests would be essential for asymptomatic aneurysms and ruptured aneurysms. The prognosis of a ruptured brain aneurysm depends on how much the aneurysm bled, how quickly you received treatment, and if the treatment of the aneurysm was successful. These are my references. Thank you for listening.